how to use Airsupra. And remember, this is a rescue device. Don't mix it up or make it your maintenance device. It is approved for asthma rescue. It is shown to have a lot of benefit for people and reduce exacerbations. And I want you to know that you do still need to rinse your mouth after, because it does contain inhaled steroid inside. If I were you and you were prescribed this, remember it does contain an inhaled steroid. You got to rinse your mouth after. Remember, you got to shake it up the first time you take it out of the canister and right before you use it. You only prime it the first time you use it, but if you haven't used it in a week or so, you may need to prime it again just to make sure you get enough medication. We are going to check our device, make sure we have enough. I'm almost running out. But this device, you would shake it and then you would prime it if you've never used it before, or it's been a week since you last used it, because remember, it is a rescue, so it could be sitting around in your purse or in your backpack or in your car for a long time. You want to prime it to make sure it works. And I'm priming it now. It does. Now we're going to make sure that we exhale, empty our lungs. We're going to then put this device in our mouth, hold it down. At the same time, we're going to take a deep breath. So watch me closely, and we are going to count to 10, but you can count to 5 if that's all you can do. I wish you all the best. And after this, I hope you will be able to know that Airsupra has the benefits of rescue only, and that you're not going to confuse it or dismiss your other medications, because those are critical. They're going to be your baseline. All right, here we go. Exhale all your air and watch me as I press and inhale at the same time. And the timing needs to be perfect. Don't lag it. Remember, you don't see any residue coming out. You don't see any mist coming out. If you do, there's a problem with your device. If this is a problem for you to use, remember, you can always attach it to a spacer. I'm not going to go over that in this clip, but please remember to look out for video clips on my site that give you clues on how to use devices that are MDI or HFA for a spacer utilization and how to attach it, the benefits of it. And if you're not sure, please take a look at those videos, because many of you are using your inhaler that looks like this incorrectly, and therefore you're getting sick often. You are seeing doctors often. You're getting steroids, pills, IV, hospitalization. Some people, they lose their life over poor control of asthma. I hope this video helps, and I want you to remember that you need to follow your instructions exactly. Don't try to be your own doctor. Don't try to do your own thing, because then you're just cheating yourself. I hope this helps. Take care.